Hi Shashank, welcome to the show. Thank you so much for being here. Can you please introduce yourself to the audience?
Hi, Shrey. Thanks for having me on your show. Uh, I'm Shashank. I'm the co-founder and CEO of Alyve Health. Uh, as a quick introduction, I was born and brought up in Bangalore, India, uh, where I had a pretty standard middle class upbringing. Went on to do my mechanical engineering from NIT Karnataka. Back in the day, it used to be called Regional Engineering College, Karnataka, which is on the coast of the state. Uh, did some software programming for about 12 months with Oracle. Then went on to pursue my MBA studies from XLRI at Jamshedpur. Post XLRI, I spent quite a few years in the management consulting industry, predominantly in the financial services space with a specialization in insurance. My last corporate job before I founded Alive was as a partner at Boston Consulting Group in their Mumbai office. I was aligned to the insurance practice. Uh, 2020, around beginning of 2020, which was just before COVID, I decided to start Alive Health uh, with a couple of co-founders who were pretty close friends before we embarked on this journey.
Shashank, can you please share with us what insight led you to start Alive and what does Alive do?
Yeah, sure, sure. So there are two aspects of this answer, right? One is at a deep personal level, and then second one is at a professional level. Because I used to be in this space earlier as well. At a personal level, my father actually went through multiple healthcare events in 2018 and 2019, almost for a couple of years, wherein every time I had to actually fly down from Mumbai, where I used to work, to Bangalore, where my parents live, and I had to deal with the various aspects of the healthcare experience or healthcare industry that typically Indian consumers go through. So, ranging from a simple doctor visit to expert visits to scans to hospitalizations, right? And over there, uh, I got this feeling that it's a pretty hard thing to do, compared to the other aspects of our life, uh, be it mobility, be it food, be it culture, which are kind of sorted for us today with respect to what we can do at a click of a button. Healthcare was very different. Healthcare felt like you're climbing a mountain. Even after, for example, paying your insurance premiums or having the resources to pay for healthcare, right? And that was one insight which I even till date I distinctly remember, and I thought to myself that here I was, a partner in one of the premier consulting firms in the world, and working with several insurance companies. Have also done quite a bit of work in healthcare, but when it comes to end customers experience, it was quite appalling, right? On a professional front, again, like I said, I used to work with many insurance companies as part of my job, and everybody used to talk about how to make insurance more customer centric, but nobody did anything about it back then, right? So, for example, the insurance product in India covers just hospitalization largely, right? So it requires a customer to actually become a patient at a hospital, spend a reasonable amount of time there before one can quote unquote claim benefits from the policy, right? As a result, the product actually hasn't achieved what we call product market fit in startup parlance. Because after about uh, 4 or 5 decades of feverish selling, we've achieved a number which is about 5% of the total healthcare spend in the country is paid for by private insurance. So the total healthcare spend in the country is roughly $250 billion, and private health insurance actually uh, pays for about $12 billion. Right? So there is a massive gap in terms of the market, how far the product needs to go. If you look at it purely objectively and professionally as well. So these were the two, specific points of insight, I would say, both on the personal front as well as the professional front, which led me to believe that this space requires new thinking. This space requires product innovation in such a way that the product is ultimately customer centric, and therefore here we are.
And Shashank, can you please elaborate on what does Alive do?
Sure, sure, sure. So now that this problem was clear, uh, Alive is basically an ambitious effort at solving this problem. To put it simply, Alive offers extremely customer-centric, personalized health plans, which pretty much cover most of the healthcare expenses of our customers, right? uh, and to kind of carry on with why is this a solution. Like I said, today's traditional health plans, or what is typically called health insurance, covers largely hospitalization. So in any given year, about 5% of insured lives get hospitalized. The rest of the people, actually almost everybody who has any form of health plan coverage today, do incur expenses such as visiting your doctor's office, getting a scan done, purchasing medicines, so on and so forth, till you get to your well-being, your sports, and so on and so forth, right? So the gamut of your healthcare and wellness interactions are quite wide, and they're quite many. So what Alive is basically offering all of these use cases uh, on a cashless basis in our health plans. So in a way, if you're covered by an Alive Health plan, for example, you could just book workouts at your neighborhood gyms. You could probably book a sports court and then join the paddle trend or the pickleball trend. uh, you could sort of walk into your doctor's office, scan and pay using a live wallet. You can just book medicines from the comfort of your home in a cashless manner, and the medicines get delivered to you. So all of these use cases are possible. Of course, it depends on what your health plan covers you. So in a way, it's a simple subscription product. Uh, Whatever the health plan covers you for, you can actually utilize them in a cashless manner. And what your health plan doesn't cover you for, it actually becomes a pretty good discounted offer to you. So in either ways, our customers actually win. So that's the product proposition as we stand today.
Shashank, I also want to understand from you, as you have been working in the insurance space for quite a while now, and we were just discussing how traditional health insurance plans do not cover OPD coverage, even medicines coverage, and they just cover charges if you get hospitalized. Why do you think the traditional industry has not transformed in this manner of covering other charges also?
Yeah, there are a few key reasons why this has not happened. The first one is what I call this requires the building of a integrated healthcare ecosystem. So let me explain. So with Alive, for example, with all the providers I mentioned, whether it's a doctor, diagnostic service, hospitals, clinics, and so on and so forth, we actually have an integrated offer, which means that the customer basically has to come onto Alive and place an order. The order is transmitted to the provider in a seamless manner. And therefore, when you actually go to the provider to consume that service, the provider recognizes that this has already been booked and the service is actually cashless for you. Uh, this is actually quite a hard thing to do because there are several types of providers, and each provider has its own nuance. For example, there are thousands of labs and hospitals in the country, and maybe hundreds of brands of gyms and so on and so forth, right? For an insurance company, traditionally this was never core business, right? So because the core traditional thought process was that there is enough and more growth available in hospitalization coverage, and then why not just focus on that, because that the operations and the technology for that is largely built out by them and what are called third party administrators. So it was there, and therefore the capital actually moves to what is already existing instead of actually uncovering something new. The second one is, of course, because this kind of an ecosystem is not there, there is a risk of frauds in paper-based reimbursements. So some insurance companies did try to launch OPD plans back in 2013, 2014, that time period. But what they quickly realized was that it was very difficult to detect and stop frauds. Customers would actually submit, bills which were perhaps doctored or fake bills and so on and so forth. And this also is a result of not having a digital integrated ecosystem. Because if you have an integrated ecosystem, you don't need to get into paper-based reimbursements, which is the model we have today. Uh, so these are the two fundamental reasons. If you're getting great growth in traditional business, why shift capital to doing something new? Because this does require a fair amount of capital for an incumbent. And the second one is, of course, potential frauds and so on and so forth in the traditional way of doing things. And then that is what has given companies like Align a good opportunity to make a difference in this space.
And Shashank, how does Alive acquire customers right now?
Yeah, it's very interesting because we actually partner and collaborate with existing insurance companies, existing large brokers, large financial institutions to acquire customers. In a way, what we essentially do is there was a gap in the market, and then there was a gap in the product offering and the technology and so on and so forth. In a way, we have identified that gap and are helping incumbents sell a better product in a seamless manner where risks and frauds are controlled, and so on and so forth. So today we work with some of the largest insurance companies, some of the largest brokers. We are starting to work with some of the largest financial institutions like your NBFCs, banks, and so on and so forth. So anywhere where customers are purchasing insurance, is a good place for the incumbents to add on an Alive Health offering and sell this. And there is great demand for such a product. That is the key thing. It is not just that there is a supply factor. Today's customers actually demand for a more holistic and customer centric product. Whenever people are buying today, especially where people are introduced to such products, they renew such a product year after year after year, right? So there is massive demand in the market, and we are enabling incumbents to actually sell a better product.
Shashank, I'm just curious to understand, like a lot of patients in India have a lot of OPD expenses. Like if someone is diabetic, they need to visit doctors regularly, get blood work done regularly, get the medicines regularly. So does a life cater to those to that segment also?
Yeah, we do. So today's Alive caters to groups. Okay, so like I said, we acquire customers through multiple demand channels, and ultimately all of these are communities or groups for us. But where we are taking the product is actually enabling personalization to the extent that you spoke, Shrey. For example, say my company has offered me a health plan, and I have an Alive Health membership because of my company. Uh, all of a sudden, I get a nudge to say, okay, do you also want to add on a diabetes management plan to your existing health plan? So there is a base level plan which every group gets, and then individuals in the group can actually personalize their own plans based on their needs. So somebody might want to manage diabetes, somebody might want to take care of their old parents, somebody else might want to, would be in a phase of life where they perhaps need an IVF. So all of these use cases, because they are possible on a live, and because the platform actually understands the user pretty well, the user can potentially add on and customize their plans based on what they want to do and what they ought to do, right? Because there are some things in the healthcare experiences that we don't wake up wanting to do. For example, I'm sure none of your listeners wake up excited to take a preventive checkup, but that is something that each of us need to do, or we ought to do that. And then the platform also understands this aspect as to what is it that specific individuals really need to do, even if they are not motivated to do that. And how can these kind of nudges, motivators, actually help them pursue the right healthcare path.
And Shashank, in which geographies is Alive present in right now?
So we are a pan India platform, in the sense that we don't offer our plans to customers who are outside of India today. So you need to be within the geographic boundaries of India. And within India, you can potentially be in anywhere. And the way we do this is, uh, in a sense, our supply is aggregated. By what I mean to say is that, by that what I mean is that we work with multiple provider and provider networks, integrate with them, and that is how we get the scale that is required. So you can be pretty much anywhere, and there's a good chance that we'll be able to serve you.
And what is the long-term vision behind Alive?
It's a very simple vision. As we build this, we would like to continue to cover uh, most of the healthcare expenses, or household healthcare expenses of our customers. For our customers, we are the platform of choice uh, to experience any form of health and well-being that they're looking forward to. But more importantly, by actually being able to personalize plans based on our customers, we want to be able to move the needle in terms of how we can help our customers live their best lives on a daily basis.
Shashank, wrapping this episode up now, do you have any concluding thoughts for our audience?
I just want to say that, some of the largest problems are the hardest ones. So whether it is healthcare, whether it's education, agriculture, uh, I would really encourage your listeners to, uh, you know, think hard and long as to how to make a positive impact in the world around us. And with sufficient thinking, sufficient time, and the right team, the largest problems can be surmounted.
Okay, Shashank, thank you so much for your time.
Thank you, Shrey.